Hi, I'm Dr. Erin Michos. I'm the Associate Director of Preventive Cardiology at Johns Hopkins University School of Medicine. And I'm really excited to be here at ACC 23 Scientific Sessions, where we just got out of the late-breaking clinical trials session this morning when we heard the exciting new results of the CLEAR Outcomes trial. So there's overwhelming evidence from genetic studies, observational studies, interventional studies that LDL cholesterol is causally related to atherosclerotic cardiovascular disease risk. And we really need to have lower LDL for longer and get there faster. But unfortunately, numerous registries have showed us that many high-risk patients, are not at LDL goal. And unfortunately, statin intolerance is a big problem in clinical practice. And certainly there is this nocebo effect where patients may, think a medicine's gonna harm them and falsely attribute symptoms to that medicine. But, it's really challenging because the symptoms are real to them, and many patients cannot tolerate a statin, either complete intolerance or what's more common is partial intolerance, where they may be on a low-dose statin but not at a level to reach their LDL goals. And so we really need new tools in this. And so this is why I was very excited about the CLEAR Outcomes trial, which investigated a bempedoic acid in a group of patients that either had established cardiovascular disease or at very high risk. So it included both secondary and primary prevention, which is really important. And it was enrolled nearly 14,000 patients, followed for nearly 40 months. And compared to placebo, bempedoic acid lowered LDL cholesterol by 29 milligrams per deciliter, about a 22% reduction in LDL. And this translated into a 13% relative reduction in 4-point major adverse cardiovascular events, and a 15% reduction in 3-point MACE, which is cardiovascular death, non-fatal stroke, or myocardial infarction. So this is really, really important because, for one, this trial included nearly 50% women. So women have historically been under-enrolled in prior cardiovascular trials, and this is one of the things I'm going to be talking about at this meeting in my talk tomorrow about lipids management in women. And women are also more likely to have statin intolerance compared to men. And so to be able to have more tools, and this results were as anticipated, that we know that if we can lower LDL, we can lower major adverse cardiovascular events. And so it's exciting that we have another oral option now for patients that can't tolerate statins. And I'm really hoping this translates into getting a label indication by the FDA for the primary prevention population, because that's a big gap in clinical practice. For secondary prevention patients, there are some other tools like the PCSK9 monoclonal antibody inhibitors or inclisiran, but those are not approved for primary prevention outside of heterozygous FH. And so you have this big gap of clinical practice of primary prevention patients who can't take statins and their LDLs are too high. And I was very excited in CLEAR Outcomes. They showed benefit in that primary prevention subgroup with a hazard ratio of 0.68 in the primary prevention group. So that was very exciting, and there was no interaction by sex, so that women benefited equally to men with this agent. And some more things I was really excited to see is that there was no signal for increased risk of tendon rupture. Some very earlier studies had suggested, a possible risk of tendon rupture that might have been spurious, but the FDA has that as a potential warning in the packaging, and some patients that kind of scares them off from using this really potentially important agent. And so in this large trial of nearly 7,000 patients that were on bempedoic acid, we didn't see any increased risk in tendon rupture compared to the 7,000 on placebo. And the other thing is that there was no increased risk in new onset diabetes. So we know that statins, especially high dose statins, can slightly increase the risk of new onset diabetes. For most patients, the benefit of statins far outweighs the slight risk of new onset diabetes. But for patients, they worry about that. It comes up a lot. I mean, almost every time in clinic it comes up whenever I recommend a statin, patients bring that up. So I think that this is really helpful to have an agent that doesn't increase the risk of new onset diabetes. Now, and there was a small increased risk in gout and cholelithiasis, about 1% increase. This has been seen in other bempedoic acid studies. The amount increase was relatively small, but that would be one thing that we'd factor into the big picture. But overall, I'm really excited to have a new tool in the toolkit to help lower LDL and help our high-risk patients get to LDL goal.